I'm on my way to see Antonio Medina, a therapist in McKinney, and I can't wait to see the kind of work that he's doing. Antonio, I'm so excited to see the kind of work that you're doing. I can't wait to hear all about it.
Well, welcome, and it's my pleasure. Thank you very much for coming.
So, Antonio, in psychology and therapy, we talk a lot about the interplay between the mind and the body, between our thoughts and our actions, and so on. But I think that increasingly there's acknowledgement by mainstream therapies and other clinicians and even our clients that there's a third thing there. Religion, of course, has always known this. They refer to it as a soul or a spirit a lot of times, or what have you. How do you incorporate this holistic viewpoint in your work?
No, I agree with that. The way I incorporate holistic views is I take what you said earlier, the mind and the body, but I also discuss about the subconscious, the unconscious. I discuss a person's spirit and soul and their attitudes and their beliefs about it, and I incorporate their meaning, their interpretation of those things, and I include them in the therapy that I do here. I would say that about a good 80 to 90% of all the work that I do here is holistic because it's our essence. And in traditional psychotherapy, we're excluding those when in fact it's the thing that we should be incorporating and discussing more.
Several years ago, it seemed that there was a big swing to kind of the pharmaceutical solutions for mental health issues. But the past few years, I've noticed on my end that I've been meeting fewer and fewer clients who are looking for kind of a magic pill. And people who are more concerned about what they're putting into their bodies, the kind of things that they're doing, and how it's affecting them. So more clients are looking for maybe natural methods. Have you noticed this shift as well?
Yeah, actually I have myself. I've been doing therapy for a little bit under 15 years, and in that time I have seen a shift. I think early on people were quick to go to the medications, and I think with time people are starting to realize that it's time to go back to the basics, and sometimes people forget that medications only treat part of the symptoms. In the case of depression, it might treat the physiological symptoms, but it's not addressing the cognitive and the emotional components of depression. And so I have been seeing more clients who have been interested in actually addressing the root cause versus the symptoms that they're experiencing. And so you have seen an increase in Chinese medicine, in herbologists, naturopaths. And so more people are looking for something that's not going to give them the side effects and the ill effects of medications.
And what are some of the non-traditional methods that you use in your practice to kind of promote this kind of change?
I think probably the two methods that I use is hypnotherapy. Hypnotherapy's been around since the beginning of time. It's actually a very natural process that you and I experience on a regular basis. And then the other one would be the incorporation of speaking to your subconscious. A cousin of that intervention would be known as guided imagery, and as I think a lot of your viewers may be familiar with, the difference between guided imagery and this type of work that I do is it actually teaches clients how to trust their intuition, how to communicate with their intuition, with their subconscious mind, with their spirit self is what I call it, so that they can receive the guidance, the answers, the truth, and access to all the answers on why they are the way they are.
Okay, definitely. So it's kind of insight based, but using these methods that kind of go deeper into
Absolutely.
themselves, the self. I guess.
This is all about root cause, and the best way that I could describe it would be, say that you were a landscaper, and I called you up and I said, hey, I have a weed problem. Well, traditional psychotherapy would include spraying a product over your lawn. And I would say maybe a good 50 to 80% of the weed problem goes away, only to come back.
Yeah.
With these types of interventions, the holistic interventions where we're incorporating the spirit self, we're removing the root. And if there's no root, then there's no weeds. And that's the way we address it.
Yeah. And I can see, using that metaphor, how a lot of people can be really excited about the kind of traditional work, because you can see the results real quickly, right? The weeds are gone.
Absolutely.
For now.
Absolutely.
Do you think rapid change is still possible doing that kind of deeper insight-based work? Or do you think it does something that takes, a long, long time?
Not necessarily. And I call those pivotal moments, aha moments, or even epiphanies. I mean, there's nothing really new under the sun. But when we talk about having those aha moments, that is the first step towards substantial, or as we would know as second order change. And that's what I'm all about. I'm about second order change. And the holistic approaches that I use are aimed at gaining those second order change, systemic changes that are long lasting.
Cool. And from the work that you've been doing, are you seeing people actually live their lives differently? Once they have been working here and doing that kind of work, are they going out in the world and being different, or is it something that kind of is only known to them? In other words, could other people kind of tell that a change has taken place?
Absolutely, absolutely, and it starts with a person's energy. Like, you go places, and you could sense the energy in the room, or sense the energy of the space that you're in, or even you interact with somebody and you can tell their energy is off. So absolutely, when a person has that aha moment and has access to that root cause, and they choose to change their opinion or their belief about an experience that they had, then emotionally, psychologically, behaviorally, and spiritually they shift. And the world gets the benefit from that as well.
Okay, cool. So it kind of permeates out into everything, the way they carry themselves, their attitude.
Absolutely.
You can probably even see it in their eyes a little bit.
Absolutely. They're doing things that they didn't think that they could do. They're able to realize that a lot of their problems had to do with early childhood. And that's kind of a lot of the work that we do. We do a lot of regressive work. There's an intervention that I call sweeping the ages. And that's when we tap into a person's present day issues. And what we do is we talk about the emotions and the cognitive things that are happening in the moment. And what we do is we have them close their eyes. Because symbolically, when we close our eyes and we're doing these types of interventions, we're no longer seeing with the brain. We're seeing with the soul, symbolically. And when we do that, we start at a very young age. And what we're looking for is for the familiar emotions that they're currently experiencing. And once we identify that first experience, then we know exactly where we need to go.
Okay. Yeah, definitely. So a lot of the issues that clients face, they're not new. They're old. They've been around for a long time.
All it is just it's same setting, same theme, a different movie, just a different title.
Yep.
That's all it is.
So for me personally, right, I'm Mexican-American. My family is from Mexico originally. This is even way back, before Texas was Texas, but when it was Mexico still.
Yeah.
But there's a lot of native blood there, a lot of native history, which I really don't have access to. Do you think that we carry with us not only kind of our personal life history, but also kind of our ancestry, kind of maybe even some of the trauma that has been inflicted on our ancestors generations ago?
Right. It's a very good question. And as a holistic clinician, I think that that's a kind of question that we would be able to explore in here. I think at the beginning and at the end of the day, it's very important to ask the client what it is that they believe. Because when you look at the foundation of beliefs and their opinions and their attitudes, even their attitudes about who they are or who they'll become, that's where we have to start. Now, you said not having access. Well, philosophically, we could if we had the technology. But since we don't have the technology, does that say that we still don't have access or have the propensity to carry on previous traumas? As a holistic clinician, I would actually go back in time, not doing a past life regression, but just going back and doing a journey with a client and asking them to look within themselves to see if anything comes up from that. And that's the magic of therapy. And that's the magic of a lot of the holistic interventions, is that there really isn't a formula. There really isn't a yes and no response. It's about asking the client, it's about asking you, do you believe you still carry on some of that trauma from past relationships and grandfathers and great-great-grandfathers that you may or may not have access to? And a lot of the holistic work that we would do would be exploring that as an option. And if it turns out that you were able to gain insight that there was, then it'd be about healing that part of you and realizing that that belonged to them and not to you.
Yeah, I see.
And that's regarded in the holistic view as an emotional debt.
I see. So healing it from now forward.
Absolutely.
Okay.
Absolutely.
So the world is changing rapidly. What are some things that you're hoping for or excited about the future?
Well, earlier you asked about the move from traditional medications over to holistic medications, and I think it would be my hope that humanity learns that there's value in learning about themselves, in making sure that in the same way we're so focused on taking care of ourselves physically through exercise and gyms and eating right, that there's value in also healing away some of the wounds and also nurturing your mind as well. So I think that if I were to summarize that, the way I would go by it would be, right now there's still a lot of stigma for mental health. I wish that we could get to a place to where that stigma dissipates and people would be looking forward to actually getting help from a professional. I've always said that seeing a therapist doesn't mean that you have a problem. It really means that you're looking for a solution.
So Antonio, you moved here not too long ago from California after having a successful practice over there in California.
Yeah.
What are some of the similarities and differences that you've seen between working in the two places?
I think that one of the apprehensions that I had about moving from California to here was just not knowing if my way of doing therapy was going to be embraced. And doing very little research about what Texas was like and what Dallas was like. I definitely, I'll admit, I had a lot of apprehensions and a lot of fears of what it would look like for me doing private practice here. But once I arrived here, and I remember I arrived here in the summer of 2015, and I started operating out of my house. And I was there for about maybe 3 to 4 months and eventually branched out into this office that I've been to since 2016. And I've been very pleasantly surprised that the residents of Texas, of Dallas, of North Texas have been very welcoming. I think that it feels like for me that people here are very invested in their health and their mental health, in wanting to preserve their relationships with their children, in wanting to preserve their relationships with their families, their extended family, with their spouses, and more importantly with themselves. And so I've been able to thrive here, and I've been able to utilize a lot of the holistic strategies that I was using back in California, and it's been a tremendous blessing.
So, Antonio, outside of your work, who and what are most important to you?
I think for me, aside from the givens, family, friends, and health, and God, of course, I think the freedom to take care of oneself. I think sometimes we work so hard and we're doing so much for our community, our clients, and for everyone else that sometimes we forget about ourselves and we have to take care of ourselves. So I think for me, what I value most is being able to make sure that I'm okay up here and up here so that I could be okay for everyone else. And so Self-care, I think, ranks number one, aside from the givens of family and friends. Hi, everybody. My name is Antonio Medina. I'm a licensed marriage and family therapist doing both traditional and non-traditional psychotherapies, which include heart and hypnosis. If any of you have any questions about the holistic interventions that were discussed in this film, feel free to reach me at www.medinatherapy.com. And if you haven't heard, please feel free to join our Facebook group, North Texas Mental Health Professionals Today.
Therapist in McKinney, and I can't wait to see the kind of work that he's doing. Uh-oh. Locked here. Yeah?
Yeah.
Huh. So that's my bad.